Welcome back to Eliances Heroes, where heroes in business align. To be part of our super community and find out more about Eliances, visit www.Eliances.com. Now, back to our super host, David Cogan, founder of Eliances.
Super duper is the day today. We just had the creator of Bikini Luxe, who took on the establishment of LinkedIn, grew her business at bikinilux.com. Later on in the show, we're going to have the founder of Coyote Ugly. Their locations are everywhere, and, well, the whole movie was created from her. And later on, we'll be ending the show with amymancuso.com, well-known event planner, and has created so many incredible events. We're going to hear about some of them. Let's go ahead and let's get started with our next hero. He is a clinical neuropsychologist specializing in neuropsychological assessment, including dementia, Dr. DenBoer, mental edge neuropsychologically, SmartBrainAging.com. All right, so doctor, let's go ahead and talk about this. How do you know if you need a neuropsychological, huge, big word for me, assessment?
Took me a lot of years of medical school to say that word, David, so not a problem. The reality is that you don't truly know. Most of these times, psychological, just like problems with addiction or problems with your brain occur without us really knowing it. And it actually takes a while to develop until people that love us say to us, I think you need to see somebody. Typically, who you see is your primary care physician, and your primary care physician, at least in our area, dementia, doesn't quite know who the best people to refer to. So neuropsychologists are actually a very small niche profession in the United States. There's only about 2,500 of us. And what I do is I help detect and prevent dementia.
I mean, that's pretty incredible. I mean, you developed and you tested this smart product. I want to talk about that through multiple research studies. You serve patients that are diagnosed with mild cognitive impairment and early-stage dementia. Now, we hear the terms dementia and Alzheimer's really intermixed. What exactly, though, is dementia?
Easiest question of the day. Dementia is basically when your brain ages faster than your body. And what happens is your brain is aging at an accelerated pace, and what it does is it shrinks ever so slightly year after year to the point that somebody with somebody that dies with dementia may have a brain that's actually about 2/3 of the size of a regular brain. So it shrinks. That's essentially the short answer to that. And sub-question, Alzheimer's is a type of dementia, just like a Honda might be a type of car. It happens to be the most prevalent type of dementia, but there's a lot of others that are out there that are equally as devastating.
And if we live long enough, are we pretty much guaranteed to?
Yeah, that great question. Yeah, so if you over 90% of people over the age of 90 have dementia, and it's a very natural occurrence. So this is what my sort of whole vision is to change just the idea of what dementia is. It's a disease that everybody gets predominantly if you live long enough to a subtle degree, and it actually is a very intervenable and treatable disease. Many people think it's just an inevitable cause of aging, and so what we do is we have a Medicare reimbursable product and an online product that helps prevent that effectively. But my number one goal in life is to get people just aware that this is a disease that they don't have to accept.
Well, let's hope I don't start forgetting things. I got to ask you, though, SmartBrainAging.com. Now, you created this Smart U product. What is it?
Yeah, so this idea that we do keep our brains active as we age has been an idea that's been around for at least 40 or 50 years. The unfortunate reality is most people keep it active in the wrong way. They keep it active by doing the things that they already know how to do. So my grandmother is the spirit behind this, behind my whole life essentially, and she helped raise me and died of dementia, unfortunately. And she was doing the New York Times crossword puzzle up until stage 3 dementia. She didn't know anybody, but she knew how to do the New York Times crossword puzzle. That's not an easy crossword puzzle, as you probably know. So if you already know how to do it, it doesn't count as dementia prevention. So what we do is new and novel learning, things that your brain has never encountered before. What that does is release a chemical in the brain called glutamate. It prevents the brain from shrinking at the accelerated rate that we talked about earlier.
Oh, I mean, incredible. And you're listening to Alliance's Heroes with me, David Cogan. Be a hero. Go to where entrepreneurs align. Be part of the community. Eliances.com. That's ELIANCES.com. And we're here with Dr. John DenBoer, SmartBrainAging.com, who is just doing incredible things. Now, doctor, what if someone takes your program, but maybe they're not diagnosed with dementia? What happens?
Yeah, so this is one of the biggest points, is that our program is actually designed for people that have not been diagnosed with dementia. We want to prevent you from developing dementia. So we want to take those people that are in their 50s and in their 60s and in their 70s that haven't really had a lot of problems, and we want to prevent them from developing it. So you don't truly know whether you are going to develop dementia or not, and there's no way, quite frankly, that any scientist could tell you that you would. We know that dementia develops 8 to 10 years in the brain prior to us starting to see symptoms. So what we do is we try to get people before that 8 to 10 year window.
Now, you're also, I think it's important for everyone to know, you're also part of Eliances. You're a builder in our community. You've been to our events. You recently were at our grand table and stuff. Share briefly your experience.
Yeah, it's really impressive. And the people that are, I guess, with me in this room, Glue and yourself, do particularly great job of promoting and keeping Alliances going. As the founder of a company, David, I can empathize with you that it's not an easy task, and you do it effortlessly and tremendously. And the event that happened on Tuesday was incredible. Nice job.
And we're honored to have you part of it. Now, you also specialize in sports-related concussion, sports psychology. How do you help athletes improve their game? Is that possible?
Yeah, I do a little bit of that as well. And what I do is I try to draw on the athlete's natural sort of tendencies and the things that they do well and accentuate that. And then I also work in the area of concussion. And I look at the effects of repeated concussions on dementia and specifically. But my main thrust is in the area of smart brain aging and dementia prevention.
What are 2 secrets that I can do that our listeners can also do to maybe help improve their memory, help sharpen their skills?
Yeah, and so here's the unfortunate reality is that we don't aim to improve your memory. We just aim to prevent it from getting significantly worse. We actually think that you can always use tricks and mnemonics and relaxation techniques are always good to improve one's memory in the short term. But for people like Lou and yourself, you're not at significant risk for developed dementia, but let's say in 20 years, maybe you should start utilizing our product to help prevent the onset of it. We think that any product that's out there like Lumosity or other brain games have been shown not to work because they claim to improve. And as you may know, Lumosity was successfully sued by the FTC for false advertising.
Wow. Now, to get to where you've gotten takes many, many years of schooling, years and years of training. What made you decide to go into your field? Was it I understand for your grandma's point of view, but at what point did you say, yeah, this is what I want to be?
I wanted to help people, and I always knew that from a very young age. And I, like probably a lot of people, I get a lot of pleasure in helping people and seeing people solve a problem in their life. And dementia to me is the world's biggest healthcare problem that exists. It's probably, to me, the number 2 problem in the world next to climate change.
What advice would you have for parents that are out there that would like to have their children? Everybody says, I'd love to have my child be a doctor, go into this field and stuff like that. What kind of guidance can you give them?
I think the landscape is changing a bit, but I've always told my grandmother actually saved from my college education. I was very fortunate, and she always told me that the best investment that one could make is in education. And I feel like emotionally that's the case. Knowledge is power in any field you go in. And 2, the interest rates are ridiculously low on student loans. You don't want to rack up too many, but.
Excellent. Well, Dr. John, thank you. And thank you to your grandma. You help protect your client's brain function with your Smart U application. You help with those with concussion and help athletes overcome challenges. That's a hero. Dr. John DenBoer, SmartBrainAging.com. And thank you also to our producer, Glue, at LoopyDocs.com. And when we return, we're going to have the founder of Coyote Ugly. You know the movie, Coyote Ugly, and the locations. David Cogan with Eliances.